The data shows that approximately 1 in 4 individuals in Wisconsin suffer from mental health and behavioral health issues. So it's evident that the HW Endowment should invest resources to support our communities in the hurdle of overcoming these issues.
I learned about the AHW initiative through a job posting. My initial reaction to it was very exciting to be a part of something that would make a positive contribution to our community.
At the HW Endowment, we knew that the complexities of tackling behavioral health in these communities was beyond any one organization to tackle on their own. Thus, the importance of coalition building in communities so that a group of organizations, along with systems within that community, could tackle these issues together.
So the coalition covers the Eau Claire and Chippewa counties, also known as the Chippewa Valley.
The coalition was formed throughout the development of the project. It wasn't together when we first started. And so we had over 20 organizations that have come together to really focus on youth behavioral health, providing the ability to promote resilience with the youth that we work with in our community.
Through this project, youth mental health was identified as a pressing concern in our community. Through the YRBS survey, the Youth Risk Behavior Survey, it was identified that our students had answered the question, are you so sad or hopeless that you stopped doing your regular activities for 2 weeks or more? And our number was fairly high considered to the state. And so that was something that we wanted to make an impact on in reducing that.
We have a lot of perspectives that are contributing to the work that we do. People from a variety of different sectors, whether it be healthcare or education, government, the business sector. A lot of people have come together to really share a common goal around helping kids be resilient.
Primarily work with youth serving professionals and focus on youth. We don't work with the youth directly. However, we work with those that work with youth to have a longer impact.
In the Chippewa-Eau Claire County area, our coalition there decided that they wanted to move upstream and try to address mental health of children by affecting the mental health of the people children interact with most during the school year, which are teachers and school personnel. They started mindfulness training as well as ACEs, Adverse Childhood Experiences, training for school personnel and other interested persons. This allowed then the school personnel to understand children better and to help them by providing a trusted adult person that they could talk to.
Another thing that was done was the creation of the Youth Mental Health Scorecard. And this scorecard really just highlights those behavioral questions from the YRBS, as well as risk factors, protective factors that our youth have to really give us a good picture of what youth mental health looks like in Eau Claire.
Prior to this grant, only one school provided the Youth Risk Behavior Survey, and now all 11 do, which is really great so that we can provide a county-level report, a county-level look at how our students are doing in both Chippewa and Eau Claire counties.
The mindfulness strategy was really about building up staff, teachers in the schools, and helping them to build their own mindfulness practice and then share that with their students and use that in the classrooms to help with that sad and hopeless measure from the YRBS.
The data shows that mindfulness really helps kids with this feeling of depression and sadness and hopelessness. So we've really worked with school staff to help develop those mindfulness skills for students.
And our final strategy was around education and awareness, just educating the community about ACEs, or Adverse Childhood Experiences, and resiliency. And so adverse childhood experiences being those things that happen in our life that we may not have any control over, but can affect us in the future. The main population that we focused on was youth serving professionals. So anybody that works with youth or has youth in their life, that was our main focus on who we would present that information to. And it was a 2-hour workshop was developed, and the workshop participants completed a survey. And so we were able to see, before the workshop, how much knowledge did they have, and afterwards, how much knowledge they had. And there was a huge increase in knowledge in the community, and especially in those youth serving professionals around ACEs and what they could do to counteract those ACEs and build resiliency in the youth.
Our community really focused on coming together from a lot of different sectors and a lot of different professionals and organizations. One of the first things we needed to do was kind of follow a collective impact systematic model that was provided to us through the learning community. And so we built a really strong coalition. We all knew our roles and responsibilities. We built teams around each of the strategies, and we moved forward to help kids be resilient through these strategies.
Our hope is that the resources and the capacities that have been built within the backbone organizations in each community, as well as those coalitions, will strengthen the communities and enable behavioral health strategies to live on.
So it's been a really good project to be a part of that continues to grow. Seeds are planted, they are growing in the community, which has been really exciting.